When COVID landed in Kenya in March, we had to make important changes so that we could continue to serve children, youth, their families, churches, and our supporters safely for all of them and for our staff. So some of the measures we immediately took was to close the office as we understood more about the disease. And in the process, we took advice, including conducting an occupational safety and health audit and looking at the Ministry of Health guidelines. We looked at all that information and we implemented safety measures so that we can safely return to the office. We also identified who was essential to get back to the office and also who was willing to come back to the office. With that number of staff, we created a shift system so that we avoid overcrowding. So currently we have about 20% of staff working from the office on a daily basis.
To ensure that the workplace was safe for staff, suppliers, and vendors to return back to work, we implemented health and safety guidelines and protocols recommended by the Ministry of Health, WHO guidelines, and the COVID response recommendations. At the Kenya office, we carried out changes in the workspace seating, we enhanced spacing procedures, we encouraged the staff to return back to work on a voluntary basis. We increased the office cleaning of workspaces and the general public areas. We enhanced sanitizing protocols. We also constituted a health and safety committee that monitors the standards, the compliance, the improvements and changes required to reduce transmission of COVID at the workplace. We also carry out monthly office fumigation to reduce the spread of COVID at the workplace.
We've provided automated hand sanitizers so that everyone has to sanitize their hands first. And for the visitors, we have to take the register because everyone who accesses the office must leave contacts, or for the staff, we must have that record so that in case it's required for any contact tracing or for follow-up, in case there is any issue or any case of COVID, then it's easy to identify who was in the office on which particular days. One other measure that we've put in place is to make sure that there is information, there is continuous education of both staff and visitors. And we've done this in print and also in videos. Staff are continuously updated on issues of COVID-19 through forums, even like during when we have virtual meetings or through emails, just to keep them abreast on what's going on globally, regionally, and also within the country. We have also ensured that the staff that serve food in the kitchen are educated to understand the need for continuous personal hygiene, hand hygiene, and also handling of food. We have ensured that all of them have the required certifications to handle food and train them to be able to manage the kitchen, leave it clean all the time, and handle the food safely. In case of a medical emergency, we have created a first aid room. In the first aid room, we have provided basic necessities that will ensure that the staff is comfortable and they are secluded from the rest of the staff in the office. We have displayed the contacts to close health facilities that the staff can be attended to in. We have also provided emergency contact numbers for ambulances for ease of quick evacuation. As much as the national office has ensured that the office is safe in line with the government guidelines, we strongly call for personal responsibility so that we can ensure that each one of us is safe for ourselves and for our families and for the neighbors that we serve.
to our visitors, our staff, our partners, you're welcome to the office so that we can continue serving our children and our youth, their families, and our supporters, and it's safe to do so. Karibu sana. The Lord bless you.